Lambda, the new COVID-19 variant, hasn't hit our shores yet. This is according to the University of KwaZulu-Natal professor Tulio de Oliveira. He says no African country has detected it. De Oliveira was speaking at a World Health Organization Africa virtual conference a little earlier. Reporter Heidi Giokos joins us now. Hello, Heidi. So let's start with Delta, because that's the one that's causing havoc for us here at the moment. How much havoc is it causing, not only in South Africa, but actually across Africa?
Well, according to the World Health Organization and Professor Tulio, we do understand that the damage is quite extensive, and we do know that about 16 countries on the African continent are currently experiencing a resurgence. We do understand that there's a big concern that the worst is not over, especially for Africa. One would ask why it is so bad on the African continent, and it has a lot to do with the fact, Sally, that the African continent has not vaccinated as much as the rest of the world has. We also know about over 100,000 deaths have been recorded on the African continent. Here at home in South Africa, the Delta variant, we are seeing about 300, 400 deaths recorded in the last 3 to 4 days, which is extremely concerning. But it seems as though the Delta variant has spread significantly on the African continent. We do know, especially here in South Africa and neighboring countries, the Delta variant is quite dominant. And we do know this variant is more transmissible. We're also seeing that there is severe hospitalization and severe COVID-19 in many parts of the African continent. So the concern is that it's not going to get better anytime soon, but there is hope that eventually, as more vaccinations take place, the variant will eventually die down. But let's listen to Professor Tulio on the Delta variant on the African continent.
We really worry at the moment, and just to bring you very recent data, is that it has to begin to dominate not only South Africa, but all the African infections. Again, this is when you pull all the data of Africa together, around 75% of the recent genomes of Africa is Delta, and has entered all regions of the continent. Yeah, we are talking about Southern Africa, East Africa, West Africa, Central Africa. As we increase genomic surveillance, more important is really increasing the response, given that this Delta variant is much more transmissible. It causes potential risk of reinfection with the Beta.
Yeah, so Delta is pretty much spreading across the continent. You mentioned that the official death toll from COVID-19 across Africa is around 100,000, but we also know, of course, there's major concern about underreporting of infections due to a lack of testing, not enough capacity, and similarly, the death toll is very likely a lot higher than that. Let's move on to vaccines, which you alluded to. An interesting media briefing from UNICEF today saying they've signed their first COVID-19 vaccine agreement to supply the African Union, up to 220 million single-dose vaccines by 2022. This is part of the African Vaccine Acquisition Trust. We keep hearing that there are all these donations, there are all these attempts to move vaccines into Africa, but it just doesn't seem to be happening quickly enough, does it, Heidi?
No, Sally, and I think this is the biggest concern for the World Health Organization and various countries, to say that it's all good and well for these donations to come in, but there's a huge issue with the hogging and hoarding of vaccines. And if you just look at what's happening around the world, you're seeing more advanced economies and high-income countries that are able to vaccinate a lot quicker. They have mostly vaccinated half or even more than half of their population. I read something interesting today where they allude to the fact that in the UK they're seeing a really high number of COVID-19 infections recently, but there's not much concern. And the reason for this is because a large number of the population has been vaccinated, and we understand that once somebody has been vaccinated, there is no severe COVID-19 infection or a risk of being hospitalized, which of course is what countries want to avoid. avoid. They want to avoid the pressure on the healthcare system. What's interesting here is that 50% of the vaccines that have been administered globally have been to higher income countries, with only 14% administered in lower middle income countries. And of course, this alludes to the African continent. So as much as COVAX has offered and donated and sponsored these vaccines, it's just not good enough, because you're seeing the Delta variant ravage the African continent and countries like South Africa. And the reason for this is there has just not been a quick enough vaccine rollout. But let's perhaps listen to the World Health Organization on the issue of vaccines for the African continent.
Vaccine shipments are gathering momentum. In the last 2 weeks, more than 1.6 million doses have been delivered to Africa through the COVAX facility. Thanks to France, another 300,000 doses of the AstraZeneca vaccines are expected today in Kenya and Somalia, and donations from Sweden and Norway to additional countries are currently being finalized. COVAX has been working tirelessly to clinch dose-sharing pledges and procurement deals with manufacturers to ensure Africans get their vaccines. We expect more than 20 million doses of Pfizer and Johnson & Johnson vaccines to arrive from the United States soon through COVAX in coordination with the African Union. Other significant donations are expected in the coming days from more partners, and Ms. Nguyen will tell us all about this. There is still a long way to go. So far, 50 million doses have been administered in Africa, accounting for just 1.6% of doses globally. 16 million, or less than 2% of Africans, are now fully vaccinated. This means that hundreds of millions of people are still vulnerable to infection.
Yeah, it's just not quick enough. Heidi, very quickly on the Lambda variant, which was first identified in Peru. We know it's not been detected in South Africa yet. Any news on whether it's been found elsewhere on the continent?
Not as yet, Sally, and there is also concern that not enough testing has been done on the African continent, but so far the testing that has been done has only picked up the Delta variant. Of course, there is still concern, because just like we were told about the Delta variant, do not panic, do not be alarmed. It's still only in India. Look what's happening now on the African continent and here at home. But of course, there is testing that's being done and surveillance to see whether or not that Lambda variant will spread.
And just update us here at home on how many people have been vaccinated according to the latest stats, and have we been shooting the lights out in terms of our daily jab rate?
Sally, I must say that it's quite exciting to see that in the last 2 to 3 days, South Africa's vaccine rollout has been reaching a high every day, a new peak every day. The day before yesterday, it was 160 vaccines administered. Yesterday, 181,000, over 181,000 vaccines administered as of 5 o'clock yesterday. Tonight, 7 o'clock, we'll find out how many vaccines have been administered. So it takes the total to about 3.8 million that have already been vaccinated. Of course, it's still not good enough. We need to speed that up, but the goal was to have 200 vaccines administered per day, and as the president requested, 300,000 vaccines administered per day. Now that more cohorts and other categories and other sectors of the economy are being vaccinated, it seems as though this is very possible to meet that target. Sally, I must also just add, I'm always the bearer of bad news, but there is some good news. We know that the Department of Health has just announced that it's concluded the allocation of the final batch of medical graduates into positions. This is going to ensure that provinces proceed with the appointment of eligible medical graduates in various facilities. Given we are in the third wave, given how much pressure the health facilities are under at the moment, given how desperate we need more vaccine administrators, this is certainly good news to get more medical graduates into the healthcare sector.
This is remarkable. These are the grads who were waiting for a placement to do their internship or their community service. SAMA was threatening to go to court tomorrow, I think, if they weren't placed by tonight. So it seems that the health department has done the right thing.
Yes, certainly, Sally, and I think it's fantastic news because we also know that there was an issue around not being able to vaccinate over weekends because there was no budgets and there weren't enough nurses and administrators and healthcare staff. And now we understand that this could possibly boost the vaccine rollout, especially on weekends, because now we have medical graduates who are able to filter those gaps and that desperate need for extra hands and assistance, given how severe the third wave currently is. So it's fantastic news.
Yeah, at least 200 qualified doctors who are going to be heading into those positions hopefully very soon. Thank you so much, Heidi Giokos.